Hello friends. Snoring is just not a snore. It could be your body's cry for help, especially when this snoring in sleep is associated with gasping for breath. And this can be a serious sign of a sleep disorder breathing, which is called obstructive sleep apnea. What do I mean when I say obstructive sleep apnea? Where there is a cessation of the airflow in the windpipe because of the obstruction from outside, which causes the oxygen level to go down, and this is causing gasping as well as a breathing problem. And what are the consequences of this? The consequences are patient would develop a high blood pressure, would develop a cardiac problems like cardiac attack or a cardiac arrest or irregular heartbeats, which is called arrhythmias. Patient can also develop stroke. Patient can have a daytime consequences like they would have a daytime sleepiness. They will not be able to focus on their work, and the most important thing is there are all chances of developing accidents when they are driving. And so what's the remedy to this? The remedy is that if you are snoring and having symptoms like daytime fatigability or a daytime sleepiness, or you are having an uncontrolled blood pressure, it is better that you go and consult a pulmonologist to a nearby hospital and get evaluated for obstructive sleep apnea. So please don't ignore your snore.